Hello, everyone. Welcome to Therapy Clips with Dr. O. I'm from the organization Human Service Consultants, and today our topic will focus on post-traumatic stress syndrome, and we also call this particular type of disorder PTSD. So let's talk about how PTSD starts. It is due to traumatic events such as an accident, assault, military combat, or a natural disaster. This affects the person's mental health. So post-traumatic stress syndrome is considered an anxiety disorder. A lot of times people with PTSD will go on to experience the symptoms, but also have other types of disorders going on with them, like depression, anxiety, and substance use. So let's talk about the symptoms that's related to PTSD. The first symptom type is re-experiencing types of symptoms, such as reoccurring, involuntary, and intrusive distressing memories. Also flashbacks about the trauma, bad dreams, and intrusive thoughts. The next type of symptom is avoidance. So this person will do everything that they possibly can to stay away from certain places or objects that remind them of the traumatic event. The next type of symptom is cognitive and mood symptoms. And this is related to negative thoughts about oneself. The person may also feel numb, guilty, worried, depressed, or have difficulty remembering the traumatic event. Some people may describe having an out-of-body experience. So they feel as though the situation is not real. And what we call this is derealization. The final category of symptoms is arousal symptoms. And this includes hypervigilance. That's a fancy word for saying the person is on edge and very watchful of their surroundings and people in their environment. So, some things that may be related to arousal is that they're easily startled. Also, they may have trouble falling asleep or may have outbursts of anger. Once again, PTSD is related to trauma. And trauma can occur in any type of situation, once again, accidents, military combat. But one thing that people don't think about a lot is that it can also happen as the result of child abuse or domestic violence. So please keep that in mind. Now, sometimes when people have PTSD, they may re-experience the trauma. They may also have symptoms such as the flight or fight symptoms, such as they're easily startled. Their body will increase in heart rate. It may be a pumping of blood to the muscles, and the body is preparing to fight or to flee. Now, this occurs with people who have PTSD, but it doesn't mean that there's something that's actually getting ready to harm them. But their body will react like they are about to be harmed. And so that way they feel as though they need to run or stand there and fight. Now, it takes a practitioner, a therapist, a physician, a psychiatric nurse, a social worker to determine if someone is experiencing the symptoms of PTSD. Let's talk about the treatment now. What's available for the treatment of PTSD? Once again, PTSD stands for post-traumatic stress syndrome. And so the treatment centers on psychotherapy, medication, self-management strategies. So psychotherapy is once again talk therapy, which can include cognitive behavioral therapy or other forms of psychotherapy. The medication is anxiety-related medications. Self-management strategies include soothing oneself, mindfulness, service animals, and any other form of relaxation for that individual. Deep breathing, meditation. These are the things that we're talking about. So with that being said, you now understand what PTSD is. You understand the causes, and that's traumatic events. You understand the different types of traumatic events. And you also now understand the treatment that's available to help anyone who is experiencing PTSD. Once again, I'm Dr. O from Human Service Consultants, and I want to wish you a beautiful day. And also, don't forget, love yourself. Take care of yourself. There's only one you. But don't forget, in the process of loving on yourself, take the time to love someone else. Why is this so important? Because when we take the time to love someone else, it helps us to feel good. So have a blessed day, everybody, until we speak again.